Hello, everyone. My name is Jana Daoud,
I'm Ashton Drake.
and with the assistance and guidance of Dr. Nicholas Pellick, we present to you the off-label use of amitriptyline to treat chronic pain disorders. To start things off, when a patient is diagnosed with a chronic pain disorder, providers typically prescribe anti-inflammatory and narcotic medications to aid in immediate relief. This could be medications such as naproxen and ibuprofen, or much stronger medications such as hydrocodone or oxycodone. Although there are minimal trials, recent studies indicate that off label use of antidepressants, particularly tricyclic antidepressants or TCAs, are effective in reducing long term pain. Off label use of a medication refers to the use of a medication for a purpose other than that's intended. In this case, it's using antidepressants to treat pain in patients who are not diagnosed with depression. Tricyclic antidepressants act on serotonin and norepinephrine reuptake, thus impacting pain perception. In this study, we analyzed the effectiveness of amitriptyline to treat chronic pain in individuals with migraines and fibromyalgia over the course of 4 separate studies. Some key concepts to keep in mind for this presentation is that the neurotransmitters serotonin and norepinephrine are known for their effects on mood and behavior, but also play a vital role in the sensation of pain. Because the tricyclic antidepressants block the reuptake of these neurotransmitters, it results in increased concentration within the brain. Although this does work to improve both mood and decrease sensation of pain, not all antidepressants will work for all patients due to the inter-individual variance of the neurotransmitters.
When looking at amitriptyline's use in treatments of migraine, we analyzed two separate studies which had participants take either 25 milligrams of amitriptyline or a placebo over the span of 12 weeks. Looking at this first graph here, we can see that in study 1 on the left, 34% of placebo participants reported a greater than 50% decrease in headache frequency, compared to 55.3% of the amitriptyline group. And in study 2 on the right, it was 20.4% in the placebo group versus 39.1% in the amitriptyline group. Both studies included participants which reported adverse side effects, including drowsiness, fatigue, dry mouth, and weight gain. And when looking at fibromyalgia, we analyzed two more studies which had participants take either 25 milligrams or a placebo over the span of 8 weeks. Looking at the second graph here, we can see that in study 1 on the left, 24% of placebo participants reported an overall improvement in symptoms compared to 36.5% of the amitriptyline participants. In study 2, 49% of placebo participants versus 74% of the amitriptyline participants reported an overall improvement of symptoms. In fibromyalgia, we also had participants report side effects similar, which include drowsiness, fatigue, dry mouth, and weight gain.
To wrap things up, amitriptyline showed positive and promising results for treating both migraines and fibromyalgia. In those with migraines using the amitriptyline, headaches were found to rarely occur compared to prior to the experiments. Similarly, participants with fibromyalgia reported a decrease in the pain that affected daily activities, particularly sleep. However, many patients were unable to tolerate amitriptyline due to the uncomfortable side effects, as previously mentioned, fatigue, dry mouth, and weight gain. The number one side effect found to be reported across almost every experiment we analyzed was the daytime fatigue. Patients were unable to tolerate that they were unable to complete day to day activities because of how tired they were. Some things to keep in mind for further studies is that amitriptyline is known to have been a go to treatment for migraines for decades, but its use in fibromyalgia has been insufficiently researched. Within our extensive literature search, we were virtually unable to find any fibromyalgia studies conducted within the past 5 years. Amitriptyline's use for treating migraines has yet to be FDA approved because of the low research in this field. Further research and funding is required to encourage providers to use TCAs in treating patients with chronic pain, and TCAs may also be successful when treating other neural disorders, but further studies are needed in order to ensure that this is a successful route to take. And that wraps things up. Thank you.